Okay, so this is the removing of the NG tube. So first you got to have an order in order to remove it. So I have my order here that Ms. Wicker, because I was the one that admitted her. She has done good with her decompression, no more issues with swelling in the abdomen. So the doctors told me that I can remove her NG tube. So like I said, you have to have an order. So I have my order here. It's okay to remove NG tube if patient is not nauseated for less or greater than 48 hours, which I've had her for 4 days. So she's no longer nauseous and she's ready to eat. So what I'm gonna do, the only thing I need now is a red bag. So I will have my red bag, because remember, anything that comes out of the body has to go in the red bag. So I have my red bag and I will have my gloves in order to discontinue it, all right? All right. Good morning, Ms. Wicker. How are you doing today?
I'm doing good.
Did you sleep okay last night?
Yes, ma'am.
So I know we talked about getting the NG tube out, and I told you we had to wait on the doctor's orders. Well, today is the day. He has told me that we can take your NG tube out. So once we take your NG tube out, we're gonna give you a good rest for about like an hour or so. So I know people always want to eat ice chips right after because their mouth is dry. But we'll do like some lemon swabs because we don't want to agitate anything. And then during lunch, we will advance you to a clear liquid diet, see how you do, and we'll move further on that. Is that okay with you? Okay. All right, so I have my gloves and I have my red bag, and we've already had you off a suction. So everything looks good. Once we take it out, we'll look at it and make sure that there's no issues or anything or any kind of blockage that may have stopped the reason why anything wasn't flowing and was like a false, because if it was a blockage, we may have to put it back, okay?
Okay.
All right. So I'm gonna put my clean gloves on. All right, and this is what I would have my alcohol swabs to remove the adhesive from her nose, because like I said, it's been on here for a while. So I'm gonna use my alcohol swabs to get that off. All right. Okay, Ms. Wicker, I'm gonna start pulling out. When I start, it's gonna be like a fast process. So I want you to take a deep breath when I tell you to, and it's gonna come out, okay?
Okay.
All right, you ready?
Yes.
Take a deep breath. And I have everything, and you wanna have this up in your hand. We're gonna put this up here. And I'm gonna untape her from here, and I'm gonna put all this in a red bag. If her gastric secretions container is still in the room, which it should not be, but if it is in the room, you do need to document what you see in the amount and the last time it should have been dumped for the doctors. And you wanna dispose of that also in the biohazard bag. And then you want to make sure she get Kleenex. So I have her some Kleenex so she can wipe her nose, because she may have some postnasal drip. If you feel nauseated, just please call and let me know. We can get you something for nausea. Because sometimes when you remove an NG tube, because it has been decompressed for so long, they may have nausea. So if you don't have an order, make sure that you get an order. And then come back and check on your patient. All right, and that's it.